Good afternoon, everybody. Welcome to my exam three review. My name is Professor Young, if we have not met. I teach class mostly Wednesday afternoon and evenings. So, my plan typically is for review sessions is I usually have you guys play a Kahoot game for review. And then if you have any additional questions about specific material or content that we are going to be having on our exam, then I open it up at the end for you guys to ask me about that. Okay.
Okay.
So I'm going to get our Kahoot pulled up here. Let me get logged in quick.
I have a crazy question. I need two devices.
For this?
Yeah.
No, 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 no. You should be, are you on your phone?
Yeah.
You should be able to still be on Zoom and then also log in on Kahoot. It should let you.
Okay. Okay.
Alrighty, let me go ahead and share my screen. Has everyone played Kahoot before? You kind of
Yep.
know how it works. Awesome. Um, so once it gets pulled up here, I'll share my screen. You guys can get logged in, and then we'll go ahead and get started on that game. And like I said, after the game, if you have any other questions about content that will be on exam three, I'll open it up for everybody to just ask questions. I do need to end our review at 3 p.m. today. I have an additional meeting after that with a student. So we're going to go till 3 at the latest. Okay.
Okay.
All right. All right. So if you guys want to go ahead and get signed into this game, I'll be right back. I'm going to let my dogs in. They're outside right now. And then we'll get going. Okay. It looks like everybody's in. So we'll go ahead and get started.
No, it's not. And I clicked for you.
Erica, were you able to join the Kahoot? Is everybody in? Okay, we'll just go ahead and get started. And if you're not in the Kahoot, you guys can just follow along, okay? All right, so on the newborn's head, the nurse notes a swelling of the scalp that does not cross the suture line. That would be a cephalohematoma. Okay, caput is what we would consider to be like our molding of the fetal head, and that doesn't have any involvement with the suture line. Same with our molding. If it were to cross the suture lines, we're more worried about a subdural hematoma or something a little bit more severe in our newborns. Yes, awesome. So any neonate that has meconium stained fluid at delivery, we need to be monitoring them for respiratory problems because we're worried about meconium aspiration syndrome. Okay, so first, like, who can tell me what the Moro reflex is? Let's start there.
Isn't that the one whenever you like startle them, like falling motion?
Yeah, so the Moro reflex is the baby startle reflex, and it typically looks like when the baby gets scared, they go like this with their hands, like their hands throw, they flail their arms a little bit. That's their startle response, okay? If we have a fractured clavicle, that baby is not going to be able to like lift their arm. They won't be having any motion. That arm will be limp, hypotonic for sure, resting at their side. So they will have an uneven or an asymmetrical Moro reflex with the fractured clavicle. So, if we have a mom with diabetes, our baby is prone to hypoglycemia because they have that rapid drop in glucose while the baby is still secreting insulin. So, anything that's going on in mom's metabolic system is ultimately being mirrored or happening in baby's metabolic system. So, this baby is still going to be over secreting insulin whenever they are born, causing them to have that hypoglycemia, which is why we are monitoring our babies born from diabetic mothers pretty closely after delivery to make sure that their blood sugars remain stable. Who can tell me like what we want our blood sugars to remain above for a newborn?
Is it 40 to 45?
Yeah, 40 to 45. We want that blood sugar over 40 um, to be considered that the baby is regulating their blood sugar correctly. Okay, so with a post-mature neonate, that means a baby that's born post-date. So typically any baby that's like 41 weeks or over. These babies basically will have been cooking a little bit too long in utero. So we're going to see that leather-like dry, cracked skin. They're not going to have very much vernix. They may have a little extra like wrinkles, like looking pruny a little bit almost whenever they're born. They're going to have very little amounts of like hair all over their body, like they're very well developed. So this is what we can expect to see with a post-mature neonate.
I'm gonna remember that. You said they've been cooking too long.
They're cooking way too long.
They're leather knife.
That's the best way for me to put it. I'm like, you're in there for a little bit too long there, baby. Yes. Okay. So when we're maintaining a neutral thermal environment for our baby, we need to avoid placing the crib close to the nursery window for family viewing. Okay. Because we want to make sure that this baby is warm, that they're not too close to a window, that we want to make sure that their body temperature is being regulated. Because we know that babies have poor thermoregulation. So we need to make sure that they're dressed appropriately for your guys' exams. I'm not sure if your professors in your class hit on it, but like you will need to know like how heat is lost via like conduction, evaporation, and like examples of those and like how to prevent those from happening. Okay. Yeah, we're going to get a serum glucose. So when we look at this question, is that temperature normal?
I think normal is 97.7, is it?
Yeah, it's like around normal. It's not like super low to the point where we're
Mhm.
suspecting this baby is like cold. And we also know that babies don't have a shiver reflex like adults do. They're not going to shiver to regulate their body temperatures. So what we can assume is like we see that lower lip that's shaking, um, and his hands are quivering a little bit whenever we're doing that Moro reflex. We should be thinking that this baby could be jittery, which is a sign or symptom of hypoglycemia. So we're going to want to get a blood sugar on this baby. Okay. The other options stimulate the baby to cry. We don't really need to. That doesn't really fit in this question. Feed the baby formula. We don't necessarily need to do that yet because we don't know what his blood sugar is. If we need to supplement, then maybe we can give formula if the mom wants to. Um, and then if this baby, if we're worried that he's cold, we're not going to take his hat off. So we're going to get a blood sugar on this kiddo to make sure that these symptoms that he is having are not signs and symptoms of hypoglycemia. Yes, we need to keep our babies nice and warm. So we're going to place the newborn under a radiant warmer because we know that these babies have a hard time with thermoregulation. So anytime that they're a little bit cold, we're going to be putting them under the warmer to help maintain their body temperature. Yep, molding is a normal side effect of labor and delivery of the birth process. So, telling the mom that the baby's head formed to the shape of the birth canal and that it will go away is the proper response. Yep, sternal or chest retractions. Great job, you guys got it right. Cyanosis of the hands and feet. How long can we see that in a newborn baby?
Couple of hours.
Yeah,
Is it like up to
10.
1 to 3 hours or something?
yeah, cyanosis, like acrocyanosis can last. I'll have to look and see what your guys' textbook directly says, but that can last for a couple of hours after delivery. So that's not something we need to be concerned with. If the baby is like over 24 hours and they start to have like acrocyanosis again, then we're going to be a little bit concerned. So at this stage, shortly after delivery, we're not worried about that. Mucus draining from the nose, there's going to be mucus draining from the baby's nose and the mouth. They were just born and came down through the vaginal canal, so they probably swallowed a whole bunch of fluid. So that's going to be normal. And a regular heart rate is something we can see in a newborn as well. So we're not concerned about that either. But definitely, any type of retractions can show signs or symptoms of respiratory distress. And that's something that we're going to want to deal with immediately. This is the Moro reflex. So the grasp reflex would be if you put your finger in the baby's palm and then the baby's hand will close around it and grab your hand, grab your finger. The Moro is the startle reflex. The rooting, yep, rooting reflex. Yes, the anterior fontanelle is open and diamond shape at delivery. The posterior fontanelle is most likely closed. If not, it closes not too long after the baby is born and a full-term infant. But yes, the anterior fontanelle is going to be open and diamond shaped. So the correct answer for this would be I should shampoo the head after washing the rest of the body. That's the appropriate way to go because we want to maintain baby's temperature, right? And babies are going to lose a lot of their temperature through their head. So if we're getting them like all wet and stuff, we want to make sure that we're saving that for last because that's where a lot of the heat escapes is from the tops of the heads, right? So that is something that we can educate our patients' parents on whenever they're going to be giving baths at home. Yes, the pulse rate is way too fast. What is something that we worry about if a baby is tachycardic?
Infection, maybe?
Infection. Yeah, it's kind of just like if we were to get sick, I mean, your heart rate is going to elevate, your temperature is going to rise, your blood pressure may or may not rise or fall. Most likely it'll get lower. But so yeah, if we have a baby whose heart rate is 178 beats a minute, that is way fast because our highest point for babies is usually 160. So anything higher than that, even if the baby is full term, we are going to want to observe that baby, monitor that baby very closely. Yep,
Mm.
awesome. Yellow. You guys are going to need for your test to know the stages of newborn stooling and what is normal versus what is not. Okay.
I'm sorry, I keep losing connection, so I'm just back.
Oh, no, you're fine. Welcome back.
Mhm.
Yes, awesome. You guys all got it right. This baby might lose a little bit of their weight, and that is okay to see 3 days after. Yes. So, um, this is something that we refer to occasionally, like on labor and delivery, as like the first period. It's obviously not a period, but it is okay if we see like bloody mucus in a newborn baby girl's diaper. This is because that cessation of female sex hormones transferred in utero from mom to infant. This is a normal thing that can occur. It's definitely something that we want to talk to our parents about. Because I had one time a parent call in to the labor and delivery floor, like freaking out, like, my daughter is bleeding. I don't know what's happening. It was in her diaper. It's like this mucusy stuff. It looks like I don't know what happened. And they were like full blown panic. So we need to educate our parents that this is something that can happen with little girls. This is a normal thing that can occur after delivery. Yes, if this baby has not peed after 8 hours, that is something that we're going to be concerned about, and we're going to need to bring to the attention of the nurse practitioner. Those pasty yellow brown stools in 24 hours is okay if their temperature is normal, and if baby refuses to feed once, that's all right. Like they don't have to necessarily feed every single 3 hours. If babies are too sleepy or whatever, we give them a little bit of time. But if the baby is not having any voids for the majority of the day, that is something we would need to call. Yep, so Milia is normal. We just tell parents to leave it alone. It'll go away on its own. Yep, so we need to depress the bulb before inserting it into the tip and the tip into the side of the mouth. Then we release it and that draws out that fluid. What is the order that we suction in usually?
Mouth first.
Yep, mouth and then mouth before nose. Yep, M before N. Yep, good hand hygiene. The best way to prevent infection. Mongolian spots are going to be those dark areas over the sacrum. The Epstein pearls are like the little white spots that can be inside of a baby's mouth. Yes, pain. These are all pain scales. This is our transitional stool. So this is when it's going from being meconium to when it's going to be like normal baby poop after that initial newborn period. Ear infections, yes, this is something that we want to know about with a child of a cleft palate. That could be signs or symptoms of infection. So we need to monitor these babies very closely because their palates are not intact. Yes, okay, so if we have an Rh negative mom, she's going to need RhoGAM if the baby is Rh positive. So you guys all got that. That's awesome. The light breaks down bilirubin. Yep, awesome guys. Those lights are specifically what we use to treat hyperbilirubinemia in a newborn. So for the test, you guys will need to know about that light therapy. You should also know that like babies, temperature should be regulated every 2 hours whenever they're receiving that kind of treatment. And under the light, they can only have a diaper on, and uh, everything else should be exposed.
I'm sorry, your voice was going out after regulate every 6 hours.
Oh yeah, so we want to make sure that their temperature every 2 hours, we're going to do a temperature on these babies. Because typically they're also under the warmer and under the light they can get kind of warm. So we want to make sure that they're not too hot. And then we also want to make sure when they're under the light that they only have a diaper on and all their other skin is exposed. Because the more skin surface that is with the light, the better.
Thank you.
Mhm. The babies need to have their eyes covered during phototherapy. That light can be damaging to the eyes, so we want to make sure they wear those like cute little like baby sunglasses. But we don't want to cover the baby's head because we want all that skin to be exposed to the light so that the bilirubin is broken down faster. Yeah, we're going to assess for hypoglycemia in this baby. They're a big baby and they're born to a diabetic mom. So they're definitely at risk for having hypoglycemia. Yep, they're going to have those asymmetrical gluteal folds. For a foot that's turned inward, we're more worried about a club foot. In the baby with hip dysplasia, you're going to have those folds not be even. Sometimes even the leg lengths are uneven, but the gluteal folds is what you would see probably first in a newborn. All right, guys, last question here. Yeah, babies that are born with Down syndrome oftentimes have trouble with their heart or will have some um, heart issues. Okay. All right, let me stop sharing my screen here. You guys did great in that game. Is there anything that you wanted to discuss specifically or any questions that you have on the material for exam 3?
Like the APGAR scores, are we gonna have to like fill something out or everything's gonna be multiple choice, right?
Everything will be multiple choice, just like all the other exams. Um,
Okay,
when we're talking about APGAR, you guys are going to need to know, like, if I give you an example baby, like this baby was born and they appear this way, and this is what their reflexes are like, this is what their heart rate is. You may be asked, like, what is the APGAR at 1 minute type of
got
thing.
you.
So, understanding how we use the APGAR scoring system, what each of those categories are, and how to assign the numbers will be good for you guys to know before for the exam. What other questions do you guys have?
Would there be anything as far as the clamping the cord, as far as the umbilical cord reference?
Sorry, what was that?
Will there be anything referencing to a clamping the umbilical cord as far as the vein and the arteries?
I'm not sure specifically if there will be questions regarding like clamping of the umbilical cord, but with that, we want to talk about like delayed cord clamping, know the like benefits of delayed cord clamping, and why we do that, like what the benefits are for the baby. Um, I don't know if your guys' professors have pointed it out to you, but in Blackboard and Canvas, sorry, let me pull up my Canvas so can show you guys something. Let me share my screen here because I want to show you guys where a good reference is for you as you start studying for your exam. Okay. So if you go in here to your exam 3 study session, schedule, study material, and recordings, this announcement where we post all of the instructors' recordings for the review sessions. If you scroll down here, not here, this concept review, this is a really awesome resource for you guys. Like this is something that goes through like really big key points that we want you to focus on as you're studying. We also put the rationales for all of these questions and the answers for all of these questions in this concept guide. And then it also gives you like important key terms that we want you to study. So it kind of gives you a good like jumping off point as you're studying. It gives you like a lot of really good key points for you to focus on while you're reviewing for the test. Okay. So that is in your announcement for the exam 3 study sessions. It's under here, under the blueprint, this concept review.
Cool.
Okay. What else you guys got?
Any specific video or advice regarding math, the math that we need to be knowing?
The math. So your guys' OB math assignments that you've done for class so far, that math is a lot, it's very similar to the stuff that was on exam 1 and exam 2. So as
Okay.
long as you feel very comfortable with the math that you were doing for that homework, I would practice more problems similar to that. If you go into your announcements, there's that OB math announcement that everyone should have gotten at the beginning of term. And there's some
Mhm.
practice problems in there that you guys can kind of play around with. Let me see. Here we go. Share, yeah, again. Here, this math help and practice announcement. If you like scroll down, it gives you some like practice problems, multi-step math. It goes through Pitocin calculation, infusion rates. So this is a really good resource if you guys want extra math problems.
Gotcha. Thank you.
You're welcome. All right, well, if nobody else has any other questions, we can go ahead and be done with our review today. If anyone has anything else, like please ask. I'll be posting this in my Canvas and giving it to all of your professors so that you guys will be able to review the
Okay.
Kahoot game again. Does anyone have anything else before we finish up today?
Thank you.
Thank you.
Awesome. It was great meeting you all. Okay. Good luck with everything. If you need anything, just shoot me an email. Okay.
Thank you.
Thank you.
Thank you.
Bye-bye.